Hey, Dr. Victoria Munoz here. Today we're going to be doing a microneedling treatment on Shannon. But first, you probably want to know what microneedling is. So, microneedling is a minimally invasive cosmetic procedure that treats the skin by stimulating collagen production. Also known as collagen induction therapy, this treatment creates micropunctures in the skin using miniature sterile needles. Microneedling is a cosmetic procedure that uses small sterile needles to prick the skin. This treatment aims to generate new collagen and skin tissue to smooth, firm, and tone the skin. Microneedling is mostly used on the face, but can be used on other parts of the body. And it serves to improve the appearance of acne scars, dark spots, wrinkles, and large pores. So, microneedling is minimally invasive, requiring little downtime. It's considered safe for most people who are in overall good health. The procedure may not be safe for people who use certain acne medications, those that have active acne on their face, those with moderate to severe psoriasis or eczema. You can experience minor redness and irritation for a few days after the procedure. Each session lasts about 30 minutes. It's best to see a physician that's certified for this procedure. In some states, an esthetician can perform the procedure under the supervision of a physician, and you may need multiple treatments for the best result. So you're probably wondering how much a procedure like this costs. Well, microneedling can cost anywhere from $250 to $1,500 per session. That's highly dependent on the product that you use with the microneedling. The 1,500 would be like using stem cell treatment with the session, which is typically a one and done. My patients that do stem cell, I do recommend that they come in periodically just for the hyaluronic acid treatments, just to keep stimulating the collagen to keep things moving in a positive direction. The 250 would be closer to like a hyaluronic acid treatment. And the overall cost depends on the size of the area being treated. So sometimes we just treat the face. I always recommend face and neck. And sometimes we treat face, neck, and upper chest. And of course, the number of sessions needed, I do offer package deals with my patients, and it will be highly dependent on the professional specific rates. So this treatment has great efficacy in treating minor scarring related to acne, other types of scars, stretch marks, enlarged pores, and aging skin. You may notice brighter, firmer skin days following the procedure. It also treats the appearance of hyperpigmentation or dark spots, uneven skin tone, skin elasticity, the appearance of stretch marks, of course, we mentioned that, and also hair growth in people with alopecia. Ideal results are achieved after multiple sessions, but may require a long term maintenance plan. Microneedling is far more effective than home rollers. Microneedling has gained popularity for its growing list of benefits. It is said to rejuvenate and plump the skin with minimal discomfort and downtime, and it can be adjusted to fit the person's individual needs. Microneedling is less expensive than laser and may work even better for some people. Laser treatments involve heat, which can affect skin pigmentation. Like all cosmetic procedures, microneedling carries some risks. A common side effect is minor irritation immediately following the procedure, which is actually normal. And you may also see some redness a few days following the procedure. You may not be an ideal microneedling candidate if you have certain skin conditions such as psoriasis or eczema, have open wounds or active acne, you've had recent radiation to the area, or a history of keloid scars. Approximately 30 minutes before the procedure, I apply a topical anesthetic to the area being treated, and this will numb the skin during the microneedling procedure, which The procedure itself takes about 30 minutes. During the procedure, what's happening is with the microneedling pin, I'm making small pin-like pricks under the skin. The pin pricks are so small that you likely won't notice them after the procedure. The tools move evenly across the skin so that the newly rejuvenated skin will be even. We finish your session by applying a serum or product to the treatment area. Now, depending on what we're using, if we're using hyaluronic acid, then after the procedure, I will add additional hyaluronic acid to the treatment area. If we use stem cell, I'll save a little bit of the product to work over the area after the procedure. In total, the average microneedling session lasts for about an hour. So microneedling is not as invasive as plastic surgery with minimal recovery time. Most people require minimal downtime, if any. You may notice skin irritation, redness for the first few days following the procedure. This is a natural response to the minor injuries being made to the skin with the needles. If you're comfortable, you can return to work or school after the procedure. It's best to let the skin heal for about 24 hours before applying makeup or your skincare products. Your skin will also be more sensitive to the sun, so be sure to apply sunscreen. However, it's recommended that you apply sunscreen on a daily basis to your skin anyway to prevent aging. After microneedling, the rejuvenating effect begins immediately, and you may see results as soon as a couple weeks. You'll likely need multiple sessions or complementary treatments to maintain the results, and we work with you to develop a plan of action based on your individual goals. Since your skin channels will be open and sensitive following the procedures, it's best to avoid the following for about a week: sun exposure, skincare products with alpha hydroxy acid or retinol, and certain cosmetics. You can go to ewg.org to learn more. You can help your skin heal after the microneedling session by staying hydrated, using antioxidant serum, a cooling mask, or using collagen stimulating peptides. Microneedling is a professional procedure performed by a certified physician. Unlike professional microneedling, most home derma rollers don't puncture the skin layers deep enough. While the home derma rollers might seem like a less painful option, you may not get much of a result, if any result at all. The microneedling injury made in the skin during the professional microneedling session is designed to induce skin rejuvenation. While you may be able to purchase medical grade devices online that penetrate the skin more deeply, it's best to have the treatment done professionally in a controlled environment. This can help avoid consequences that may cause permanent scarring. All right, guys, we're going to head over to my office and I'm going to show you how it's done. Hey guys, Dr. Victoria Munoz here. So I'm here with Shannon, and today we're going to do a microneedling facial. We're actually going to do the face and neck. And Shannon is currently numbing. We've got the numbing cream on her face right now. She's got about another 15 minutes, but I want to just kind of show you the setup here. So what we've got here is we've got our microneedling pin right here. And this is the needle that's actually going to go in the pin. And it actually has about 10 very small stainless steel needles inside of this device. It's going to go into the pin, and then when I turn it on, it's going to create punctures in the skin. And then, of course, it's not a sterile procedure, so I've got my clean gloves, and today we're going to do the procedure with hyaluronic acid. So as many of you know, I'm a regenerative medicine specialist, so all the procedures I do are regenerative, and microneedling is definitely that. Basically what happens is when we use the pin on the skin, it creates microtrauma in the skin, and there are different depths to which we can set the microneedling pin depending on how deep we want to go. So depending on what part of the face we're microneedling in the moment, we might go a more shallow, of course, on the forehead and around the eyes. Then in the cheek area itself, we're going to go a lot deeper. Of course, along the bony structures, we're going to go a little bit lighter as well. And then along the neck, we will make adjustments, more of a moderate depth for the neck area. And so as a physician, I can go deeper than like an esthetician that's doing something like this. I can actually go to 1.5 millimeters, but we don't usually go that deep because I go by the patient's comfort level. So I don't necessarily want the patient to be comfortable, but I don't want her to be in extreme pain. So I'm always checking in with the patient when I'm doing the procedure. And there's different solutions you can use for the microneedling facial. We're going to be using the hyaluronic acid today. You can also do PRP, and you can also do stem cell with the procedure. I like to do the hyaluronic acid. I think it's most beneficial for patients to come in once a month to do this. If you do it more frequently, you're creating more microabrasions in the skin, and then as the skin is microabraded and then heals over time, if you do it more frequently, then you get a better effect, I feel. The stem cell works really well. That's something that maybe patients might come in once or twice a year for, but sometimes it's good to do the microneedling with the hyaluronic acid in between those sessions just to continue to create that microtrauma to the skin so it has to repair and build stronger and to tighten and repair. So I actually did a session on my face last night. That's why I'm a little bit red. So as you can see, recovery is pretty quick in terms of, your appearance. I mean, I can go out today just fine and not worry about people wondering what happened to my face. But, and I don't really feel that it's necessary to pulverize the skin. Some clinicians will do that, and it does create a lot of trauma to the skin, a lot of recovery. But the reality is if you're doing this every 4 to 6 weeks, then you really don't need to do that. After about 4 sessions, the collagen is about 400 times stronger, no joke. So that's why I like to do it more frequently. And with each session, you're going to see improvement in any laxity in the skin, any lines, and just lifting and tightening the skin to a more youthful look. All right, so with Shannon, we're going to start with forehead and we're going to work our way down. I like to go bilateral. So what we're going to do is I'm going to do the forehead, and then I'm going to do the temples and around the eyes on both sides. And then we're going to come down and do the cheek, chin, and then the neck. And so if you can see here, there's some laxity on Shannon. Usually I just do the throat area, but with Shannon, I'm going to do around the ear. I'm going to actually do behind the ear, and I'm going to come down a little bit on the side of the neck on both sides just to address this. And then the under part of her chin isn't too bad, but this line tends to start to show on people with age. And so I like to address this. And actually, Shannon's going to be doing some Botox in about a week. So when we do the Botox, we'll probably put some in the platysmus here to help that muscle relax. That's basically what's going on here. The platysmus starts to show through as we lose fat in the neck area. And when we put a little Botox in there, it helps it to relax and not kind of push through the skin so much. And go ahead and turn your head a bit. There we go. Yeah, a little bit of laxity behind that ear as well. So, yep. And so we're going to go shallow. Going to check in with the patient, of course. Maybe start with 2, see if we can go up to 0.2, see if we can go up to 0.4 for the forehead. And then definitely 2.2 around the eyes. And then when we do the eyes, we want to stay on the bone, so we want to stay on the orbiculus. And so we'll just pull the skin down, we'll microneedle, and then we don't actually do the eyelids, we just do the upper part, the hood of the eye. And so I pull this up and microneedle, and then some practitioners do the nose. With Shannon, we don't really need to do the nose, so I didn't numb the nose, but we'll come through here, we'll do this buccal line here, and we'll really address the cheeks to help tighten them up and help pull her face up this way like that. And then I didn't numb her lips, but we'll do the upper lip, of course, and the bottom lip, and then around the chin. All right, Shannon, you ready? Mm-hmm.
Tell me how that feels. Is that, can you feel it, or can I go a little bit more?
It doesn't really hurt, yeah.
Okay. Let's go up to 0.4. Some people's forehead is more sensitive, so. We want to see the redness. How's that feel?
Fine.
Okay. Because you do have a tendency to get lines on your forehead, we're going to go definitely as deep as you can.
That'll help me.
Yeah. Because you happen to get as much Botox, you know. I'm going to have you turn your head this way a little bit while I do this side. So during the procedure, even though I'm adding the hyaluronic acid to the skin, I continue to add it to the areas that I've already treated just to help it to absorb into the skin and to get into those layers. So we're getting a nice response. Nice and red. All right. So keep your head in that position. We're going to do that temple first. Put some on the side. We'll try to go a little bit deeper for this. So I'm going to turn it to 0.6. How's that? Okay.
It feels good.
You're pretty tough.
Feels good to me.
Yeah.
Make sure I stay in picture.
Go ahead and turn your head that way. Good. The reason I like to go bilateral is because then I'm not adjusting the microneedling pin as much. If I just did one side of the face, I'd have to adjust it for each section and then go on the other side and do all the adjustments. Yeah. Plus my hand is a little greasy from the solution that I'm using, so. All right. Now let's do the eyes. So under the hyaluronic acid under the eye and on the hood of the eye. I'm going to start at 2.2, and then you let me know if you can tolerate it a little bit more.
Bottom or top?
Let's do bottom first.
Oh, you could go more.
Okay. Yeah. All right. All right. 0.4. I'm going to really pull that skin down. There we go. There we go. Is that okay?
Yep.
Does that feel
really light?
Okay. Sometimes, depending on how much laxity is under the eye, I might just pulse it like this instead of run it across the skin. But I think that's what I'm going to do here. You want to see a reaction, which means a little petite eye. And we're getting it, see that? Yeah. They're going to be black probably.
That's fine.
All right, and then let's do the upper part. And because, again, the laxity, I'm going to pulse it up here. That skin is so delicate.
Yeah, I am very sensitive up there. Oh, thin.
All right, let's get in here on closed feet. Yeah, good. All right, and let's do the other eye. All right, I'm going to pull that skin down. There we go. I find when with the more delicate skin and the laxity combined, if I do go back and forth, I can't go as deep. So if I pulse it, I can put a little more pressure on it and get those little microabrasions a little deeper on that skin. All right, let's do the upper part. Okay, good. All right. Go ahead and let's go ahead and do the cheekbone area, and then we'll go into the buccal area.
Okay.
So, right, you can definitely go a little deeper on this. I'm going to go 0.8, and you let me know how it feels, okay? How's that feel? Okay?
Oh, yeah.
Okay, good.
People funny, I'm more concerned about your camera angle. It doesn't really hurt.
Good, because we're getting a good reaction. I think you're good and numb too. It helps. Go deeper on the buccal area. I'm gonna go 1.2. Let me know how that feels.
Fine.
Okay, good. So you can see for the more lax areas, I'm kind of tightening, holding the skin taut to really get in there. If I just did this, then the skin would move too much. We want it. There we go. Now we're getting a good reaction around the ear. All right. Let's move over to the other side. Nice. Okay. Do this. See if that'll stay out of the way some more. There we go. There we go. A little lighter for the cheek. Bone. Sorry about that.
Okay.
Trying to get this thing here the right angle. It's not in your face. All right, there we go. Okay. Nice. Those beautiful creases.
Losing all that weight.
Yeah.
Getting older.
Yeah, weight loss will can definitely do that. Oh, sorry. Don't poke you in the eye.
Are we still in view? I just want to make sure we're still in view.
What's that?
Are we still in view? Because I can't see the camera very well, so.
Yeah.
Okay.
All right. I'm going to get around the mouth area now. Start with the upper lip. And with some people, that is more sensitive. So I'm going to go to 0.6 and let me know. How is that? Is it okay?
Yeah, it's all right. Tolerable.
Okay. Go ahead and tighten your, yeah, there you go. Perfect. Beautiful. All right. Now we're going to go down here on the chin. I'm going to go a little bit deeper. 0.8. Let's go with 0.8. Is that all right?
Mm-hmm.
Okay, good. And we're going to be able to do 1 on that. Let's go with 1.0.
Oh yeah, I can't feel anything, so.
Oh, you can't? Okay, good.
Not really.
Do me a favor, open your mouth. Ah, there you go. Nice. You get those creases around the corner of the mouth there. You've got some larger pores in your chin here.
Mm-hmm.
So this can definitely help that. Before I continue, I'm actually going to change the needle out. All right. So sometimes we change the needle out. It just depends on how much work the pin is doing. Today it's doing a lot of work. So
I need it apparently.
all right. All right. Now we're going to start moving along the jaw, under the jaw and the neck. And I like to get this area really good just to tighten that up. Even though the laxity here is actually coming from here. A lot of people don't realize that. But the way this latissimus muscle connects, actually connects up here in the zygomatic process. So the skin also follows that same pattern. And but just improving the integrity of the skin there helps tremendously. So, all right. And we are at 0.8. I'm going to actually switch hands to do the under part of your jaw. How's that?
Well, it's a lot better than I thought it would be.
Can we go a little deeper?
Yeah.
Okay.
Oh,
Yeah, let's go deeper. All right. Should be tough. You can handle it. All right. Here we go. Yeah, the needle's moving much smoother over the skin now. Doing okay?
Oh yeah.
Go ahead and turn your head that way. Perfect. It's really important to keep the pin at a 90-degree angle on the skin, because if it starts doing this, we're not really getting an effect. So keep an eye on that, especially with these angles. All right. That okay?
Mm-hmm.
I usually don't go right over the esophagus. If that skin needs it, I usually try and pull it to the side, because this can be a little uncomfortable. So yeah, we're getting a nice reaction there. I usually go down to the collarbone. And today we're not doing the upper chest, but if we were, then obviously we'd go below the collarbone. All right, go ahead and turn your head this way. Perfect.
You okay?
Yeah. We're going a little bit beyond the throat here, to the side of the neck, to get that loose skin. It's kind of playing into that laxity, and under your chin too.
Mm-hmm.
Nice. Let me see the side again. Let's go over that a little bit more, especially this part here.
Okay.
Is that okay? Numb, right? Yeah, okay, good. I was careful to get the numbing cream way back here, but you'll know when I've hit the border where it's numb.
Pleasant. Sorry.
Yeah, this isn't like your feel-good spa day.
It doesn't hurt. I mean, it's not hurting me.
Good.
I like it.
All right. I like to look over the face and just see if there's any other areas that we can, like, I want to get the glabella a little more.
Okay.
I didn't really get in there as much. I did the forehead, so let's go ahead and get in the glabella. Yep, so your eyes are already getting black.
That's okay. That's gonna
Which
happen.
with Shannon, this happens every time.
Yeah.
So yeah, but otherwise it looks good. Yep. So let's go ahead and get that area, and then I think we can call it.
Put your fingers in before you do it.
What's that?
Said it's on your fingers now. You might as well.
Yep, that's right. All right, so we're going to go about 0.8. Let me know how that feels. Wait till this thing stops blinking. I don't know why it does that. It's weird. All right. You okay?
Mm-hmm.
Go brown. Yeah, there we go. Yeah, we like your eyebrows. Is it a little bit painful?
A little, but that's
Yeah.
okay. It's
Okay.
wearing off of it, but that's okay.
Yeah, okay. Well, we're not going to have to spend much time there. There we go.
Oh yeah.
Beautiful. All right. So as you can see, we got a really good reaction. We want the bleeding because that means we went deep and got in there to really address the deeper layers of the skin, and then creating microabrasions that will, over the next few days, start healing up and increasing the integrity, improving the integrity of the collagen. So Shannon will not actually wash her face today. What we're going to do is we're just going to go over her face really good with the hyaluronic acid. We're just going to kind of massage the blood spots in a little bit. And she will wash her face tomorrow morning, actually. That will be the next time. So hopefully she doesn't have any dinner dates tonight. Hot dates or speaking events. All right. If you need to tonight, you can put a little bit of ice on these parts here, just because, you know, they have a tendency to swell, and you have a tendency to get little hematomas there with these treatments. But don't leave the ice on like too long, just kind of pulse it, you know what I mean? So like a couple minutes, take it off, couple minutes, take it off. Do you have a hat or anything for today?
I'm just gonna go right home and smile away.
So after these treatments, we don't want any sun exposure to the skin. So it's really important to protect your skin, especially on your way out to the car. And of course, I always recommend sunscreen after 9 a.m. Barrier sunscreens are best, which are the zinc oxide sunscreens. You can go to ewg.org to look up the toxicity level of your sunscreen. And you can actually, if you already own it, scan the barcode, and it'll tell you. But the zinc oxide or the barrier sunscreens, we don't really want to use chemical sunscreens because they have a tendency to be toxic to the skin and cause skin cancer. All right, there it is. All right, guys, so that was Shannon's microneedling session. So her post-treatment instructions are to not wash her face for the next 24 hours. She can actually wash her face tomorrow morning. That would be fine. And then I'm going to give her a little bit of hyaluronic acid to take home. She can continue to moisturize her face with that. Just her usual skin routine tomorrow will be fine. Obviously, we want our patients to wear sunscreen after 9 a.m., regardless of whether they've done this microneedling treatment or not. So I recommend a barrier sunscreen, which is the zinc oxide. You can go to ewg.org to look up the toxicity level of any products, actually, not just your sunscreen, but your beauty products, your shampoos, the products you use around your home, and just really reduce your toxic load. I hope you enjoyed this video, and see you next time.